When we think about cancer research, our minds often jump to genetics, mutations, DNA, molecular diagnostics. But there's a fascinating layer we sometimes overlook: the physical and mechanical properties of tumors themselves. Today, we're exploring an emerging field where physics meets oncology, and it might just change how we diagnose and treat cancer. The German research unit 45628, hosted by the Charité University Medicine Berlin and the University of Leipzig, has recently outlined how tissue stiffness and fluidity can influence cancer progression and be exploited for future diagnostic applications. I summarize here the exciting conclusions of Sauer and colleagues published in Advanced Science, August 2023. Imagine this: all the tissue in your body, healthy or not, behaves like a complex living material. Some parts are solid and rigid, others are more fluid-like, almost dynamic. These properties, how stiff or fluid a tumor tissue behaves, are turning out to be hugely significant, not just for understanding how cancer spreads, but also in predicting how aggressive a tumor might be. Now, let's talk about multi-frequency magnetic resonance elastography, or MRE for short. While the name sounds like something straight out of a sci-fi movie, it's actually a non-invasive imaging technology that works a bit like a high-tech sonar. It detects how tissues respond to tiny vibrations. By doing that, it creates a rheological fingerprint, a way to measure the stiffness and fluidity of different parts of the tissue. This lets clinicians distinguish at a physical level between malignant tumors and healthy tissue. No needles, no surgery, just a scan that's rich with data about the tumor's mechanical character. Recent research has started linking these mechanical characteristics, particularly tissue stiffness, and a property called fluidity, not just to cancer's presence, but to its behavior. Fluidity, for instance, seems to directly correlate with how likely a tumor is to grow aggressively or metastasize. Essentially, it's turning into a powerful tool, a unique diagnostic layer that complements the molecular data we've already been using. So, what does this mean for integrating physical markers like stiffness and fluidity into real-world cancer diagnostics? How do we translate these fascinating mechanical principles into actual clinical strategies? Let's get into this step by step. We talked about how stiffness and fluidity can reveal a lot about a tumor's nature, right? Now, let's dive into what that really looks like in action. Researchers have found that liver cancers like hepatocellular carcinoma and cholangiocarcinoma show both higher stiffness and increased fluidity compared to the surrounding tissue. And here's the kicker: the combination of these two properties seems to correlate directly with their aggressiveness. I mean, it's not just about one being high or low, it's this balance, or rather imbalance, that defines how invasive these tumors can get. But this isn't just unique to liver tumors. We see the same pattern in prostate and colorectal cancers too. Malignant tumors, those more likely to metastasize, tend to display this dual characteristic: stiffer, but also much more fluid when compared to benign counterparts. It's fascinating because this fluidity essentially reflects how these cancer cells can unjam, almost like a crowd breaking into a run, enabling them to migrate and spread. Now, benign tumors, on the other hand, don't have this same dynamic. They're more static, and their mechanical properties are much closer to normal tissue. And this difference between malignant and benign tumors is super important. It helps us figure out not just the type of tumor, but also its potential behavior. Basically, it's like a heads up. This one's going to be trouble. Or, hey, this one's less likely to spread. To put all this into perspective, scientists have come up with a thought experiment. Picture this: a tumor at its boundary, interacting with its surrounding tissue, essentially growing and sometimes pushing, sometimes piercing through. These interactions aren't just theoretical. They have been measured on a microscale using benchtop MRE and atomic force microscopy in tumor samples. And in vivo MRE has shown the real implications for how tumors behave in the body. For example, when a tumor's fluid-like regions dominate at the edges, it tends to infiltrate its environment, making it harder to contain or treat. This emphasis on the tumor front, where all these forces collide, might be a game changer in predicting where it spreads next. So, We've talked about physical properties like stiffness and fluidity and how they shape not just what a tumor is, but what it does. But here's the big question. How do we actually use this knowledge to improve cancer diagnosis and treatment? Well, this is where imaging techniques like multi-frequency magnetic resonance, elastography, or MRE really shine. By combining stiffness, fluidity, and the mechanical texture of tumors into detailed mechanical profiles, clinicians could gain a totally new perspective on what's happening inside a patient's body. Imagine being able to assess how aggressive a tumor is before it spreads, and doing it without an invasive biopsy. That's the promise here. Now, of course, this isn't something we can implement overnight. Integrating biomechanical markers into existing imaging workflows comes with its challenges. MRE technology is still evolving, and scaling it for widespread clinical use means addressing issues like cost, accessibility, and training for medical professionals. But think about the potential, adapting MRI machines to measure not just what a tumor looks like, but how it physically behaves. And then there's the impact on treatment planning. What if these mechanical insights could tailor therapies? For example, identifying tumors that are more fluid-like and aggressive could help prioritize certain intervention strategies over others. Essentially, we're talking about adding a whole new layer to personalized oncology, one that focuses on physics as much as biology. And this is where the article by Sauer et al. Makes a major contribution to the field. They provide a roadmap to a novel prognostic tumor marker based on the stiffness, fluidity, spatial heterogeneity, and texture of the tumor front all accessible by non-invasive MRE. This line of research is still unfolding, but there's so much promise. MRE's ability to measure stiffness and fluidity could transform how we think about cancer, not just as a biological event, but as a physical phenomenon too. And if we can truly integrate these insights into clinical care, it's hard not to be hopeful. On that note, we'll see you next time. Thanks for tuning in.